just here to take your blood pressure.
Okay.
Okay. Oh, this looks good. There we go. Gotta get it all snug. Are you ready?
I'm ready. Oh, that's feeling a little tight.
Well, it's supposed to be.
Are you sure you're doing it right?
Yeah.
Evidence-based practice shows placement of the blood pressure cuff is vital to obtaining an accurate blood pressure.
Common blood pressure errors include having the wrong cuff size, having the cuff fit too loose, deflating the cuff too quickly or slowly, inadequate inflation of the cuff, having the arm below or above the level of the heart, and repeating an assessment too quickly on the same arm. For example, if the cuff is too big, it will provide a false low reading. If it is too small, it can give a false high reading. If the arm is below the level of the heart, it can result in a false high reading. If the arm is above the heart, it can result in a false low reading. Evidence shows a need to alternate arms, as repeating the blood pressure on the same arm can give inaccurate high readings. One study shows that 22% of participating RNs reported the correct cuff size was not available in their departments on a monthly, weekly, or daily basis. In another study, using silent observers, 50% of the RNs did not choose the correct blood pressure cuff size for their patient, while only 88% placed the patient arm at the heart level for blood pressure measurement.
Body positioning affects blood pressure. A study in an ambulatory cardiac clinic found that clients seated in the proper position, which is in a chair with back support, feet on the floor, and arms at heart level, had readings 12 to 14% lower than those who were seated on exam tables. If a thigh cuff must be used to obtain the blood pressure, the patient should be placed in a prone position, if possible, to maintain a level point with the heart. Blood pressure cuffs come in various sizes. The standard is 12 to 14 centimeters for the average adult arm. A narrower cuff for an infant, child, or adult with thin arms should be used. And for children younger than 13 years, the bladder should be large enough to encircle the arm completely. A wider or thigh cuff is 18 to 22 centimeters and is indicated for a client who is obese or needs to be used as a thigh pressure reading. The cuff's inflatable bladder width should be 40% of the circumference of the limb on which it is used. The length of the bladder should be twice its width.
Hi. Here to get your vitals.
Okay.
The gold standard for blood pressure measurement is the direct intra-arterial method. While the upper arm site is the most familiar indirect method of blood pressure measurement, the forearm, elbow to wrist, has been suggested as an alternative location for blood pressure measurement, particularly for the obese individual. Avoid measuring blood pressure in an arm with extensive axillary node dissection, such as a radical mastectomy or an arteriovenous fistula used for dialysis. Cuffs should not be applied to the extremity when IV fluids are infusing, or if the extremity has been traumatized, diseased, or a bulky bandage is in place. The use of a forearm is appropriate when brachial arteries are inaccessible. Ultrasound techniques, such as using a Doppler stethoscope, can be used to measure systolic blood pressure when oscillatory sounds are too faint to be heard. If upper extremities are not able to be used, a thigh cuff may be used. Systolic pressure in the legs is usually higher by 10 to 40 milligrams mercury than the brachial artery. However, the diastolic pressure will still be the same.
Hi. Just here to take your vitals.
Okay.
I was going to use your right side, but is there any reason that I shouldn't use that right side?
Well, I have had a right-sided mastectomy, so you should probably use the left side.
Okay, will do. I'm going to make sure we're safe.
Use of evidence-based practice skills can protect the patient by providing accurate blood pressure readings.